Wow, thank you so much. It's taken a tremendous amount of courage, I think, to come and tell that story, but also to continue to challenge us. And if anybody needed any further inspiration to make sure we get this 100% perfect, I think you are it. So thank you once again. So now we're going to move on to tell you a little bit more about what Forward Thinking Birmingham is all about. And I'm going to start off with sharing with you a video that we initially put together as the partnership to explain who we are and what we are all about for children and young people. And I'm going to ask John to just step up and make sure it plays properly, because technology is not my forte. At Birmingham Children's Hospital, we've been so proud to deliver CAMS services for over 15 years now, and we've worked really hard to improve quality and access to those services. When we first saw the tender document, we thought it was a huge opportunity to further improve services in the city for 0 to 25-year-olds. But we also knew that we didn't have all of the expertise that was needed, and what we did need were partners that really shared our values. And we found those values in Worcestershire Health and Care Trust, the Priory Group, Beacon and the Children's Society.
Forward Thinking Birmingham will deliver services around 3 core principles: choice, prevention and integration.
As the Forward Thinking Partnership, what's been really important to us is to listen to what young people and service users in Birmingham want. We've listened to what they're not happy about in the service today, and we've involved them in the design that we're presenting.
We're going to give children, young people and young adults a voice in their care and choice in who delivers it, how and where. We'll do this through drop-in services at a City Centre Connect support hub and Community Child and Family Skills Centre, as well as taking services to young people through recovery colleges and educational settings.
Students are already coming to college. They bring those issues with them, and it would be ideal to have somewhere that they could go within the same facilities where they didn't feel that they were having to identify or be stigmatised in any way with any of the issues.
And where more intensive treatment is needed, we'll deliver this at home in a safe and familiar environment, or in a brand new state-of-the-art inpatient hospital.
I think particularly where it's a mental health issue as well, you need to be where you feel most comfortable to best recover from your experience. So that was fantastic to be back at home with her.
Prevention's at the heart of what we'll deliver. It's about being responsive, getting in quickly and not waiting for problems to develop. We'll deliver this through free and easy to access advice and support online and in the community. Targeted outreach for at-risk and hard-to-hear groups, and we'll also be supporting teachers and other professionals who see children and young people every day. The way we integrate our care will mean that children, young people and young adults won't fall through the gaps, and their experience is consistent, joined up and supports them as they move through their care journey.
Our philosophy as the Forward Thinking Partnership is that there's no wrong door.
There'll be a single phone number available to call 24 hours a day.
So if a client's phoning, can I speak to somebody, there'll be always someone there. They won't feel that someone's brushing them aside, the support ain't there, and it will stop them from panicking as well.
A single care plan focused on helping children, young people and young adults achieve their goals, and a named individual responsible for their care.
I do think if there was someone there that could actually take into consideration my needs, and instead of sweeping me under the carpet, I think I wouldn't have had a few months of suffering and not being told that as a 17, 16-year-old that I'm gonna die and I'm not gonna see Christmas, sort of thing.
For a lot of young adults, once they know they can get the support, they will communicate, and we always say good communication promotes cooperation, and that's what it's about, communication, I think.
Each provider today has their own IT platform. What we want to make sure is that those platforms are interoperable. What we want to make sure within the single point of access that we have as a partnership is that all the information channels flow into that, so that when a young person is seen in the hub that is run by the voluntary sector organisations, or whether a young person arrives in A&E, we're able to see the care plan that's in place. We're able to have access to the crisis plan so that it becomes less confusing.
We have to help people to actually understand that
we'll make it as easy as possible, and we being all the universal services working together, let's just stop putting barriers in front of people.
Forward Thinking Birmingham is radical and innovative. It has the potential to revolutionise mental health services for children, young people and young adults, not just now but for generations to come. So that's the vision, clearly to go from where we were in February to a point of being able to start to take the service live in October is and continues to be a lot of hard work, and that's really what we've been focusing over the last months. So there are lots of groups and teams that have been set up to do the delivery of this right across the partnership. Again, continuing to work with children, young people and young adults as we develop it to make sure we absolutely get it spot on and refine it as we need to go. But also that we've got all the milestones that you would expect us to have to ensure that we can go live and we can start to deliver the service. Now, some of those things are already happening. I think one of the things that we are already very proud of, charging patients at 16 but actually keeping them inside our CAM services. I know certainly from many direct conversations that I've had just what a traumatic time that was for families, and that part is now over. We're able to keep them and know that we'll be able to move them safely within our partnerships. That's step one ticked, and we're very proud of that, and that's actually advance of the go live. Many other things we aim to go live now in October, and we aim to be completely live by April of next year. Now, some things have taken us a little longer than we initially hoped because it takes quite a lot of work to make sure we've got all the information we need in the right place, all the systems are right, we're integrating them properly, we're doing the governance right, and we work really closely not just with our partners but also partners that are currently delivering some of these services and Diane and her team to make sure we do this in the most safe, effective way possible. We don't just want to rush it and then find at the end we've missed something. But we are starting to deliver it. It is starting to feel like it's making a difference, and that's only just going to escalate on now as we move through into October and beyond to be fully up and running. There's many people here that I would like to say thank you to for it. The majority of them are wearing purple, and that is because purple was the colour of our bid. So can I ask all of my team people to give a wave and a bit of a woo, we're here team, woo! Yay, yay. Oh, I can see an IT person, wait, there you go. Adam's going to deliver the entire integrated IT system, aren't you, Adam? Unfortunately, you're also very tall, so I feel like I can justifiably pick on you. But you can see just how many people are involved in the delivery of this and the amount of resource we've put behind to make sure that everything on that slide becomes a reality, because it's only going to be successful when the first people are accessing the services and it's making a difference in their lives. And if we did need further inspiration, which I'm sure we don't after Safina, we're now going to have further inspiration to get it right. And this time I'm going to ask Ashley Wright to join us. Ashley is one of our experts by experience stars and is going to share his story. You were a little nervous before, but I've said if you've done the media, this bit's the easy bit, Ashley. So come on, tell us your story. We're all with you.